So thank you for the introduction. Yes, I'm Dr. Foley. So I'm a physiatrist at GF Strong Rehabilitation Center. And I'm so happy that you asked me to come and speak because I am quite passionate about post-stroke fatigue and helping my patients that have been experiencing post-stroke fatigue. So feel free to let me know if I'm speaking too quickly or if I say some things you don't quite understand. I'll be happy to address any questions. So my area, as you pointed out, is an acquired brain injury, and that includes both traumatic brain injury and stroke. So this is something that I often, okay, I'll just hit that button too, so that I see in my practice, whether it's my inpatients that are experiencing this symptom or my patients that are outpatients and it presents to clinic. So we'll get started. Now, oh, sorry. Yes. Maybe I may be having some technical difficulties as well. So this whole new Zoom way of speaking is new for me as well, but I'm really happy that it allows me to get my talk out there. So post-stroke fatigue is important because it's a common symptom after stroke. And it happens even if you've had a hemorrhagic type stroke or an ischemic type stroke. And we do know that globally there are approximately 33 million stroke survivors, and at least half of them are experiencing post-stroke fatigue. Initially, when the first studies were done back in the 1980s, they said that approximately 75% of people after the stroke were experiencing post-stroke fatigue. But when we changed the definition and looked at it more clearly, it looks like around half of people experience post-stroke fatigue at some point in their recovery. So as I said, it is common and it can happen at any point during the recovery process. I'm just going to change my view as well because I see all the faces are blocking and my face is blocking my actual screen here. So how do we, I'm just going to change where I see you guys, but how do you define it? So it's a subjective lack of physical or mental energy that is perceived by the individual or caregiver, and it interferes with their usual and desired activities. So that's important because it's something that the patient is experiencing, something that the patient feels. And it's not only physical energy, but it's also that mental piece. So that's important. There's two other definitions that are often used as well. So that feeling of early exhaustion that develops after mental activity, and some people describe it as a weariness or a lack of energy and aversion to effort. So that sense of exhaustion, feeling decreased energy or tired. And it's very important that you realize it's distinct from sadness or weakness or objective weakness. So it's this symptom that the patient feels, that they feel subjectively, and it's hard for other people to quantify that fatigue. And why are we talking about this? Because we know for sure that it can have a negative impact on a patient's ability to get back to doing all of their daily activities. So it can impact their ability to do, you know, their dressing, their grooming, bathing, even bowel and bladder care. It can impact their ability to participate in their what we call instrumental activities of daily living. So their ability to, you know, do their cooking, their cleaning, participating in their home care. But also it impacts their ability to want to get out and socialize, and participate with their family activities and even their professional activities when we look at return to work. So it's a very important thing that we are talking about, and looking at ways to manage it is very important. So there is a consensus among clinicians, doctors, researchers, the patients, the caregivers, that post-stroke fatigue is very important because it can impact your quality of life when you want to get back to doing all the things that you did prior to your stroke. So that's why we're talking about it today and looking at ways that we can help manage it overall. I am going to talk a little bit about the cause of post-stroke fatigue, in particular highlighting how it is multifactorial, so there's typically multiple causes, and then we'll get into how we're going to look at ways to manage post-stroke fatigue. Okay? So there's a couple of medical words that are thrown in, and then after the medical words are thrown in, I'll just say it in more plain language, but the pathophysiology of post-stroke fatigue is a fancy word to describe what is the cause. Why do patients have post-stroke fatigue? And it's thought that there's some change in the cortical excitability. So what that means is the brain's ability to send those excitatory chemicals down and communicate with your muscles. So there's been a change in that, but also a change in the chemicals of the brain and how it processes the information that's coming in as well. So it's not 100% clear why patients have post-stroke fatigue, but these are some of the theories that exist. And this is the one medical jargon line that I have in there for later if you want to look it up, but there's thought to be a low excitability of the corticospinal tract. So that's a tract in the brain that goes down through the nervous system and communicates with your muscles, but also a change in how the neurotransmitters communicate as well. We can't identify one specific lesion that causes it. So there's not one area of the brain that has had an injury and it results in it, because many different people after a stroke, it doesn't matter where the stroke happened, what side of the brain or what area in particular. We're not able to say that that is the area that causes post-stroke fatigue. So that's important to identify. But what we do know is that those people that have more motor dysfunction or tend to have more post-stroke fatigue. So for example, if you have paralysis of one side of your body, you're more likely to have post-stroke fatigue. But it's even individuals that have a TIA will often complain of post-stroke fatigue as well. So it's not the amount of deficit doesn't actually is not an actual reflection of how much post-stroke fatigue you may be experiencing. Other causes of post-stroke fatigue have been explored as well. So there's a question about inflammation. Could there be some increase of inflammatory chemicals such as cytokines or interleukins? That is being explored. It's not clear. Could it be your body's immune response to the stroke? Because we do know that individuals that have immune disorders often have fatigue as well. So there's that whole question, but it's still not 100% clear. Other things are biochemical. So after a stroke, some chemicals are released, in particular glutamate, which in fact is a bit of an excitatory chemical. If there's a lot of that release at the beginning, there's a thought that maybe those individuals later on may go on to experience post-stroke fatigue. And then there's this other piece, genes. So it might be that there are some individuals that have genes that modulate inflammation and increase this pro-inflammatory cytokine. So there may be a gene component. So you may, some people may be predisposed to experience post-stroke fatigue after their stroke. So these are the pathophysiology medical piece, but I'm going to break it down in a little bit more plain language. So when we talk about the why piece, it's the fact that your brain is working harder to process information, harder than it had to prior to your stroke. So, and at times it could be that the chemicals or the fuel or the energy, the brain runs out of it at the end of the day or after certain activities because it doesn't have the same reserve that it did prior to your stroke. So you're having a decreased ability of the central nervous system to communicate with the muscles and produce the necessary chemicals, neurotransmitters in the brain to process the information. But it's not as simple as that. So yes, we know there's been an injury to the brain. There's a change in the way that the brain communicates with the body. There's a change in the chemicals in the brain that process information, but there are other factors as well. And possibly you've heard a lot about the other factors, but the cause is multidimensional. And that's why when we talk about how to manage it, it involves doing many different things. And what I mean by the multidimensional aspects of post-stroke fatigue are, I'm going to go through them, but we do know that there are some demographic factors. So what that means is, so if older people tend to have more post-stroke fatigue. So and it's not cause and effect because many young people in their 20s and 30s after a stroke will also really struggle with post-stroke fatigue. It just means that if your stroke happened at an older age, it's more likely that you will also be one of those individuals that experience post-stroke fatigue, but it's not cause and effect, if that makes sense. the neurological and physical deficits that resulted from your stroke do play a part. So as I talked to you before, that if you have more motor impairment, so more weakness of your muscles, you tend to experience more post-stroke fatigue. We also know that individuals that have changes in their thinking skills, so if they have decreased attention, if their attention has been impacted, those individuals tend to struggle a little bit more with post-stroke fatigue as well. And also any significant aphasia, so difficulty with understanding and expressing language, those individuals tend to have more post-stroke fatigue. The other piece is the medical comorbidities. And what that refers to is any other medical diagnoses that may have arisen out of that brought you into hospital or that you didn't realize that you had. So when we talk about stroke, some individuals, will come with medical comorbidities, for example, diabetes. Individuals with many different medical diagnoses may have more post-stroke fatigue. And it may be that at the time of your diagnosis with stroke, you were also started on many medications to help manage those medical comorbidities. So for example, your doctor may have talked to you about the importance of treating blood pressure and talk to you about goals of blood pressure management. But oftentimes some of the blood pressure medications may have that added side effect of contributing to some post-stroke fatigue. The other important thing is with medical comorbidities after stroke, some individuals will also have experienced some post-stroke mood changes, and that can also contribute to post-stroke fatigue, because we do know that post-stroke depression is very common, and sometimes that can also contribute to the post-stroke fatigue as well. But it's very important that we clarify that those are two different entities in itself. Medications are a big piece of all this, right? So when you present to hospital and you may have in fact have had new diagnoses of hypertension or diabetes or possibly sleep apnea, or there are other medications that sometimes are used in stroke if you've had a seizure at the time of your stroke. All of these medications oftentimes will have some side effects. So for example, beta blockers can contribute to post-stroke fatigue. Those are often used for blood pressure management and for optimizing heart health. But in the long run, hopefully that side effect will decrease, but it's something to think about. Also, just looking at other medications that you may have been placed on for possibly sometimes medications are used to help people with their sleep, that sometimes those medications can also contribute to daytime fatigue. Also, medications for pain are a big one. So making sure that, if you've been placed on any medications for pain, that is not something that you're experiencing a side effect from the medication in itself. I'm going to be talking a lot about sleep disturbances. So we know that having a sleep disorder can be a risk factor for stroke in itself. We know that sleep apnea can contribute to, high blood pressure and maybe a risk factor for stroke in itself. But also after stroke, people will often have difficulty with the sleep-wake cycle, so getting a good night's sleep. And you may have heard from your therapist or from your doctor or your family member, oh, you should be getting up to 8 to 9 hours at night. Sometimes that can be really difficult to do. So we'll talk a little bit about ways to optimize sleep-wake cycle. And we do know that individuals with good sleep-wake cycles will have more energy and decrease fatigue in the daytime. So that's another important piece of managing the post-stroke fatigue, but it's something to think about and we'll explore. I put pain down here because after stroke, some people, but not all, may experience some what we call neuropathic pain or central nervous system type pain. Pain in itself can contribute to post-stroke fatigue. So your brain is interpreting the signals that are coming from the body. So it's using energy to interpret those pain signals. So pain in itself can contribute to post-stroke fatigue. But not only that, but some of the treatments that your doctor may prescribe to you may have that added side effect of contributing to post-stroke fatigue. So some of the neuropathic pain medications like gabapentin and Lyrica, they can contribute to that feeling of fatigue. And of course, as you know, opioids, that will have that added side effect as well. So pain is a big piece in all of this. Interestingly enough, when you explore the general population, even if they didn't have a stroke, a lot of people are struggling with fatigue. Some other medical diagnoses contribute to fatigue and have a symptom of fatigue. And so if you're somebody that had pre-stroke fatigue, you're more likely to experience post-stroke fatigue. That's not surprising at all, but it's something to be aware of, that the stroke may not get rid of the pre-stroke fatigue. And it may be something that's also contributing to how you're feeling after your stroke. The other piece, as I mentioned earlier, is mood disorders. So we know that post-stroke mood disorders are very common. It's something that is really important to screen for and, you know, tell your doctor about if you're really struggling with low mood after your stroke, because there, like, as I said to you earlier, there's a change in the chemicals in the brain, there's a change in the neurotransmitters of the brain, so it's a common thing. And a common symptom of a mood disorder can be feeling decreased energy in the day, not having the interest, and sleepiness. So it's important that if you are experiencing any mood disorder after your stroke, that you communicate that to your caregivers or to your family members and to your family physician, so that that can be optimally treated and help manage your post-stroke fatigue, because it could certainly be a contributing piece. And the cognitive impairment is another piece, because that has been associated with post-stroke fatigue. But the cognitive impairment that has really been identified as contributing is attention. So a person's ability to maintain attention is something that can also contribute to post-stroke fatigue. So if you're not able to like really attend to all that's going on in the environment, to the social interaction, that can contribute to you feeling more fatigued in the daytime. And so ways of optimizing your cognitive recovery can also help manage your post-stroke fatigue. It's all related. So when we talk about managing fatigue, there's not one cure that will completely take it away. So we have to approach it from the multidimensional perspective and attend to all those things that we went through. And so the important thing to note is that we talked about that individuals may experience post-stroke fatigue at any point during their recovery from their stroke, but it typically does seem to be heightened in the earlier stages. So, you know, in the first couple of years after stroke, more so in the first 6 months, more so in the first year, and then more so up to 2 years afterwards. But what I mean is that it's more in the earlier days. And as you tend to recover from your motor deficits, and as you return to recover from your cognitive deficits and your aphasia, then the post-stroke fatigue tends to get a little bit better as you go forward. But of course, as I pointed out, making sure not to take on any new things that may contribute to it, like medications and things like that. So it does tend to get better as time goes on, and you have more recovery and more neuroplasticity has occurred and new connections have occurred. So there's that positive piece that as time goes on, there tends to be more improvement in post-stroke fatigue. So I borrowed this from Mario, the occupational therapist at my center that often sees a lot of my patients with post-stroke fatigue. And he talks to them about how they have an energy bank. So you have an energy bank just as you have money in your bank account, and you make deposits into your energy bank and you make withdrawals. So it's really important that you don't empty your bank account and that you put more deposits in a day than you take out withdrawal. So managing your energy bank is very important, and that's oftentimes what the occupational therapist will go through, is ways to optimize and have more money in your bank account or more energy in your energy bank. So as I said, I will be talking about sleep because even though post-stroke fatigue is not a sleepiness issue, it's a fatigue issue. But we do know that if you're able to get a good restorative sleep at night, it can also help with post-stroke fatigue. So there are lots of people have probably talked to you about ways to manage your sleep, but the goal should be, you know, waking up in the morning and feeling restored. and having a number such as saying like you need 8 hours and you need 9 hours might not necessarily be the best goal. It's just the goal being waking up in the morning and feeling restored. So there are ways to help with that. So we often will talk about making sure, it's good to keep the same bedtime and wake up time, even on the weekends. We do know that avoiding alcohol is a good thing. And the reason for that is that some people will say they'll have a drink before they go to bed, but we know that the alcohol can interfere with going through those good stages of sleep. So they don't wake up feeling restored in the morning if alcohol was the way that they went to sleep in the beginning. And we also know that alcohol works on a neurotransmitter called GABA, and in the long run can have a negative effect on the neuroplasticity of the brain. So we ask our patients to avoid alcohol to help optimize their recovery going forward. It's a good thing to avoid it, and it can have a positive impact on your sleep overall. We talk about avoiding caffeine in the evening and establishing a relaxing routine before bedtime, whether it's taking a bath, listening to some calming music in the evening, and avoiding things that are activating in the evening. So no going on your computer and paying bills or anything like that, which could increase stress. So trying to establish a relaxing routine before bedtime is a good thing. The other thing is avoiding using your phone before bed. We talk about the light from the iPhone and your phone. It's not a good light. So basically the light signals to your brain that it's wake up time, and it decreases the melatonin, which is your sleep hormone. So we suggest like putting the phone away 90 minutes, an hour and a half before bedtime, and being consistent with that, and trying to minimize even though we're on screens now and this is a nice way to connect, but minimizing screen time to less than 2 hours a day is also a positive thing when it comes to optimizing your sleep. The other piece is that getting outside, believe it or not, like having a minimum of outside daylight time of 20 minutes, that's your minimum goal. Way more is even better, but we know that that is excellent for establishing a sleep-wake cycle. So having that as a goal every day. Are you going outside for a minimum of 20 minutes every day? Having that nature time, outside time, it's actually been shown to be really, really helpful for sleep. The next piece is physical activity, and this is a part I love because it seems counterintuitive that the more physical activity, the more energy you will have, because at first when you start doing it, you feel fatigued in the day, possibly after your exercise. But study after study after study has shown that physical activity is the best way to help manage your fatigue longer term. And the reason for that is that, your muscles become better at taking up the oxygen and being better able to move. It also, of course, as you know, increases your strength, your energy overall, but it has a positive impact on your sleep. And we know that restorative sleep gives you the energy that you need the next day. We also know, this is so exciting, that aerobic activity also improves individuals' thinking skills. So there's really, really, really good evidence that physical activity can improve your brain. So the actual even structure of the brain, there's changes in the brain in the hippocampal area and memory area that happens after physical activity. So we borrowed all of that information for studies that were done on in the Alzheimer's group that had changes in their memory. So we know for sure that physical activity helps improve cognition overall. And as we talked about, the more you improve your cognition, the better post-stroke fatigue can improve as well. So physical activity is our biggest bang for the buck. And so the goal for that will be, as you know, 1 week, look at your week and try to get 150 minutes in during the week of some sort of physical activity spaced out over the week. And it can be 10-minute intervals at a time. And I already talked to you about being outside for 20 minutes. So, if you can incorporate your physical activity being outside at the same time, that's a really, really great thing. So these are some other things that we use when we think about ways to manage fatigue, something called the 5 Ps. So pacing yourself, we'll go into more detail on these, but prioritizing your activity. If you find that there's something that really drains your energy bank, don't do it, or ask somebody else to do it. And it's okay to say, no, I don't want to do that. So you need to make yourself a priority, and make your activities a priority. So if, you really enjoy having some social time with some family members, if you've created a priority for that, then the other things that are energy draining, just say, no thanks, I'm not going to incorporate that into my day to day. And that's completely okay. Saying no is okay. And then planning. So that's the piece I just mentioned, just planning out your day, planning out your week to prioritize the things that you want to have energy for. And then there's this positioning piece. So I borrowed this as well from the occupational therapist, but just, if doing your instrumental activities of daily living, whether it's like cooking and laundry, and you might want to think about doing some of those tasks in sitting. If you find that it's really draining when you're standing doing them, it's okay to sit the fold of laundry. It's okay to sit the prep your food. Those things are all okay to do it that way. So ways to think about with respect to positioning. Are you well supported when you're at work with respect to your feet and where your desk is, all of those things. And then prevention is the piece where, you want to make sure that you don't drain your energy bank so that you can't get through the rest of your day. So preventing getting to the point where you're feeling completely drained and completely fatigued. And so this was just, these are just slides that talk about things, the way how you could pace yourself. Don't deny your fatigue. So if you're feeling fatigued, don't try to carry on as usual. Make sure you have those rest breaks and, relaxation time incorporated into your day. And you make sure that you alternate your activities from strenuous task to a lighter task. So pace yourself through the day. Prioritize creating balance. As I said, make sure you say no. Ask yourself, is this task really necessary? Is there somebody else I could ask to do that? And if there is, go ahead, ask them to do it, and go ahead and say no when when it's something that's really particularly draining for you. So this is the planning piece. It just means that spread your heavier tasks out over the week, and do your harder activities when you feel your best. Planning, and then the positioning is the piece I just mentioned. So thinking about your environment, sitting, using good posture. You may want to sit for some of your tasks, avoid awkward postures, and practice good lifting techniques. You may want to use tools to help you and optimize your energy overall, and make sure that you take breaks throughout the day, your stretch breaks every 15 minutes. And so this is prevention. Listen to your body's natural call for a rest. Do not feel guilty if you need to take a rest. And try, we know that working in quieter environments can be helpful as well. So if you're in a room that's very noisy, your brain has to process that noise and process that information, so it can be particularly draining. So you might want to think about doing your work or doing your task in a more quiet environment. Try, shopping when it's least busy. If you're somebody who drives a vehicle, you want to avoid driving in rush hour. So think about ways to minimize the information, whether it's sensory information, audio, ways to minimize all that information that's coming into you. And so because I'm a physician, of course, I'm going to talk about ways, medications that are sometimes used. And to be honest, there's no good medication that has been shown to cure post-stroke fatigue. Let's just put it that way. And nothing has really been shown to be like extraordinarily satisfactory when it comes to managing post-stroke fatigue. That being said, whenever there's somebody has struggling with symptoms, there have been things that have been looked at. So if you've tried absolutely everything from a management of your post-stroke fatigue perspective, you may want to talk to your doctor about if there's any medications that may help. So one of the medications that has been looked at is a medication called modafinil. And to be honest, it's been shown to be most helpful in those who have a brainstem stroke. More research is needed, but it was initially used for individuals with narcolepsy. And it does have some benefit for post-stroke fatigue. So if you are somebody who has you've been on a long journey, it's been greater than 2 years since your stroke, you've tried all of the non-pharmacological or non-medication type strategies to help manage your stroke, you may want to just mention medications to your doctor to see if you're a candidate or see if you would benefit. And so when I talk about medications, it might in fact be looking at your medications and doing the drugectomy, I call it, taking away drugs that you don't necessarily need. That's always a good thing. So making sure that you're not on any medications that you don't need anymore. And also, but of course, if that's already been done, looking at things that might help. With respect to vitamins, there actually has been a little bit of evidence for some vitamins for helping your post-stroke fatigue, and possibly some benefit with the B vitamins. So you may see that over the counter, B vitamins for energy. There's a little bit of evidence that there's some benefit with vitamin B1, possibly with vitamin B12, and then a synthetic coenzyme Q10, which is an over-the-counter type supplement that you could explore. But those things have been looked at, and there's possibly, basically it needs more research, but it looked like it was somewhat promising. Otherwise, there are things with evidence. So far, the most evidence, as I said, is physical activity. There's also some evidence for something called cognitive behavioral therapy, and usually that's something that's done with a psychologist. But and typically there's a referral made if you're continuing to struggle with fatigue. And typically this is something that lasts for about 12 weeks as part of your therapy, but it might be something that you might want to explore at some point if you've tried all of the other management of fatigue and it still hasn't completely resolved, but as another option. And then the other one that I'm going to skip down, we'll talk about the breathing relaxation, but there is evidence also for another strategy. It's evidence level B and it's even on the stroke best practices. So it's called a mindfulness-based stress reduction. So this is usually a group program, and it usually lasts for 8 weeks, and it focuses on progressive acquisition of mindfulness. I don't know if you've heard that term before, but it teaches individuals to be more mindful and aware of the sensations that are coming in. And it also explores yoga postures. It sounds kind of hairy-fairy, but it actually has some, good evidence for it. And I would certainly encourage you to explore if these therapies are offered in your community. Typically, they're offered by some of the stroke recovery, or if they have any resources that you could access. But yes, it does have, I love this because it has real evidence that it helps. More evidence than any of the medications or any of those things, which is exciting. And we know that, things that can replenish your energy bank are deep breathing, relaxation exercises, and this meditation, which is in fact incorporated into the mindfulness-based stress reduction, can be helpful. So the bottom line is that post-stroke fatigue is common after stroke, and we know that it affects more than half of the people that have post-stroke fatigue. It's very important that we talk about it because individuals that are experiencing post-stroke fatigue, as I said, it affects their quality of life. It affects their ability to get back to doing all the things that they used to enjoy prior to their stroke. So it's very important that we talk about it and we help manage post-stroke fatigue. So I encourage you to reach out to, whether your family doctor or your therapist, to look at ways to help optimize your post-stroke fatigue, and basically the goal being getting back to doing all the things that you did prior. But the most evidence, as I said before, is making sure that you have a good sleep-wake cycle, but the physical activity is the big piece here. So overall, physical activity has been shown to have the biggest impact on minimizing post-stroke fatigue in the longer run. And then other things as well that replenish your energy bank. As I said, the mindfulness-based stress reduction and meditation calming exercises have been also shown to be helpful.